We've done these with patients for years because of the symbolism and the metaphor behind these. The fact that it goes from a piece of paper
on paper
into a bird.
Jessie Park is part of the fold.
And the hope that you can put into that.
At Sanford Health's main medical campus in Sioux Falls, South Dakota.
When people ask me what I do, it's fun to be able to say, well, I'm the program coordinator of the arts program at Sanford. And then they're kind of like, what? This weird two different types of person here.
When she's not shaping arts and health for patients with her Sanford Arts crew at the hospital, something else is taking a commanding presence in her life. Park, a captain in the South Dakota Army National Guard, is now the commander of Bravo Battery in the 1st of the 147th Field Artillery Battalion.
Not very long ago, females were allowed to be in these line units. I showed up in Yankton in 2015-16 timeframe, and I was the first field artillery female officer. To have 76 people absolutely dependent upon your awareness, your leadership, your guidance, that's a huge responsibility, and it's really humbling and fun.
It's also a lot of work, and why she's glad Sanford Health prioritizes recruiting and retaining employees with military experience.
When I told my supervisor that I was going to take command and it was going to be really demanding, just tell me what you need. And that was just like, yes, thank you, great.
And that's not the only time the healthcare organization has had her sick.
Left for 11 months and then came back, and then less than a year later, left again. But every single time it was absolutely, thank you for your service, anything you need. There weren't any hiccups with coming back. It was so seamless every single time.
Sanford is now helping Park advance her healthcare career with the Sanford Veteran Professional Development Grant for employees. It's a $3,000 grant she's using to learn about addiction counseling and prevention.
To further your education, when you're now I'm a commander, and I'm also this program coordinator, the program lead, and then also I'm a new mom, all of that, there's kind of like little opportunity to do extra stuff like that. And to get that nudge of help from that grant it was just like, this is so awesome. This was the project, Survivors Behind the Mask.
The push is giving her ammunition to keep coming through for patients.
They were blown away when we presented it to them.
And those she leads on the battlefield.
I need to understand, who are my soldiers? How many soldiers do I have? Are they trained? Do they know what they're doing? Have we given them enough direction so that they know what's going on and that they can go out there and then they can make those decisions of what they need to do when we're, in the field, if we're in a wartime situation, etc. Same thing is here. I need to know what artists I have here during the day. What are their qualifications? Have I given them enough education, indoctrination into Sanford? And on the surface, it looks like there's a big difference. But when you think about the creativity of understanding what you need to do, what your mission is, who's going to help you accomplish the mission, what are your tasks, etc., it's the same.
It's why veterans figuring into Sanford Health's ranks yield a well-designed structure. In Sioux Falls, Matt Holson, Sanford Health News.